You're watching RedChip TV, your source for small cap news.
Hey, welcome back to the RedChip Small Cap Health Tech Investment Forum. I'm Brad Klein, Vice President here at RedChip Companies, and we're coming to you from San Francisco at the La Meridian Hotel, and we're bringing you some interviews of some exciting companies, and I'm happy to introduce to you today the CEO of Bioheart Incorporated. That's Howard Leonhardt. Howard, welcome to RedChip Small Cap TV.
Thanks, Brad.
Well, let me mention the symbol. Let me give you the symbol. Bioheart symbol is traded over the counter. The symbol on that is BHRT. And you have an exciting company, Howard, here with Bioheart. Tell us about the company.
Well, Brad, we are really excited about Bioheart and our future. We're a company that is focused on heart failure. We like to think of ourselves as the go-to technology partner for heart failure specialists. Heart failure is a human tragedy. It's an epidemic. It's also an opportunity. 25 million people today suffer of heart failure. That number is expected to double to 50 million people in just the next 5 years due to the aging of the population and the ability of technologies to keep people alive after a heart attack is contributing to this explosive growth. We are a company that is focused on helping physicians that are treating heart failure patients to do that better, and we have a full pipeline of products to do that. First and foremost, our flagship product, MyoCell, and MyoCell SDF1, which is second generation. It's a muscle stem cell composition for regenerating damaged heart muscle. We are the only company that's able to grow contractile muscle in scar tissue. Began clinical trials back in 2000, 9 years of clinical trials now. We're the only company authorized by the FDA to be in a phase 2-3 trial and to be up and running at 35 sites across the United States. These are the leading heart failure centers in the United States: Mayo Clinic, Cleveland Clinic, Columbia University in New York.
So that's really what sets Bioheart apart, isn't it? You're the only company doing that.
Well, we're not only the only company that's able to go contractile muscle and scar tissue, but we have a full pipeline of products for heart failure. We basically take the patients from the time that they've had the heart attack to the time of full recovery and have a full pipeline of products to care for them. Right after a heart attack, on the way to the hospital, we have our Bioheart AC Bio True Pulsal to Life Support System. It's a system that can be used in the ambulance. A small puncture in the groin, 2 punctures in the groin, 1 in the artery, 1 in the vein, the blue and the red. Right. And you hit a button and it highly increases the perfusion of the blood through the body. It oxygenates the blood, and the new model has a cooling feature. This is designed after a heart attack to reduce the scar size. Once the patient arrives to the hospital, we have another product for them. We take some fat tissue out, and we use the Bioheart TGI 1200. It's a bedside apparatus that processes fat tissue and creates 2 syringes full of stem cells and endothelial progenitor cells within 1 hour of the patient's arrival to the hospital. We then infuse those into the patient's circulation around the heart, and that serves to further reduce the scar. In our recent studies, we showed by infusing those stem cells and endothelial progenitor cells a short time after the heart attack, we can reduce the size of the scar from the heart attack by 40 to 90%. Wow. After that, we have 3 other products that we're able to offer to those patients. We'll take a biopsy of their thigh muscle and send it to our laboratory, and it takes about 2 to 3 weeks to process the muscle stem cells for regenerating the muscle. While we're waiting for that time, we send the patients home with 2 of our other products, the Bioheart 3370 heart failure monitor and the Bioheart Manebo cardio belt, which monitors the patients at home and allows the doctors to receive continuous information that allows them to titrate their medicines, to manage their care from a distance. Then they come in and get a first muscle treatment, we hope a second, we hope a third, and by the time they're done with 3 treatments with the muscle stem cells, we hope that they'll be cured and back to normal.
Very comprehensive here. It's fantastic. Again, we're talking with Howard Leonhardt, CEO of Bioheart Incorporated. The symbol for Bioheart is BHRT, and you mentioned a few, some of your current clients. Tell us about that.
Well, in addition to the 35 sites that are in the Marvel phase 2-3 clinical trial, we would call them clients and hopefully future customers for our product. Right. We also have 15 centers in the United States that have signed up with the interest in our heart failure monitoring service technology. We have 3 different levels of signing up. The first is to sign up to learn about the program. The second is to provide us a trial order of purchase orders for the system, and then finally an annual contract. And we're moving a number of those centers to annual contracts now. This is a service that's designed, amongst other things, to reduce emergency hospitalizations. The average Class 3 heart failure patient is hospitalized 6 days every 6 months. And by using this at-home monitoring technology, we believe we can cut that in half to only 3 days of emergency hospitalizations over a 6-month period instead of 6 days.
So a big opportunity for cost savings there. Tell us about your background and your team.
We really have created an all-star team at Bioheart. The Scientific Advisory Board, the Board of Directors, the management team, all have proven track records in this field of cardiology. In fact, we're in the very same building with the same colors as our previous company, and we were able to build quite a success. That was World Medical Manufacturing. We developed the Talent Stent Graft. The Talent Stent Graft today is part of Medtronic's product lineup, and it controls about 70% of the world market share for thoracic aortic aneurysm repair and about 20% of the world market share for abdominal aortic aneurysm repair. We also provided a pretty good return for shareholders in that previous company. But we have with us our senior management members have all had great successes in the field of cardiology. Our board of directors includes Dr. Murphy, the founder of Cordis Corporation, which is now part of Johnson & Johnson, but one of the cornerstone leaders in cardiology. St. Jude is a two-time investor with us and one of the leading heart failure companies. They have an observational board seat. Abbott Laboratories is an investor with us and has a board seat. We have a distinguished scientific advisory board as well. 35 leading physicians are on our scientific advisory board.
A lot of depth there.
Thank you.
And again, give us an idea of some of the ongoing milestones and projects that you're looking forward to.
Well, sometime this year we're going to share the interim data of our phase 2-3 trial. That's going to be major news to the world. This is the first randomized, double-blinded, placebo-controlled trial in the world studying muscle stem cell therapy for regenerating damaged heart muscle. We're trying to attempt to recover heart failure patients. In our last phase 2 trial that led to this phase 2-3 trial, 84% of the patients treated improved in 6-minute walk, meaning that only 16% worsened. In the control group that just received drugs, 69% worsened. So only 16% worsening in our treated group, and in the drug control group, 69% worsened. So we're looking potentially here at a great leap forward in the care of heart failure patients. That data is going to come out before the end of the year, and it should be great news heard around the world, particularly for patients and their families suffering of heart failure. The other news coming up in milestones is we hope to announce major revenues for the first time due to the heart failure monitoring contracts that I mentioned earlier. We have begun shipments of these monitors to major institutions across the United States, and we look forward to reporting for the first time substantial earnings.
That's what we're excited about, seeing it transitioning now to a nice revenue stage company here. Again, we're visiting with Howard Leonhardt. He's the CEO of Bioheart Incorporated. The symbol is BHRT. And as we close here, Howard, a lot of exciting things going on with the company. Tell us, why investors should consider looking at the stock right now.
Well, in a very difficult time around the world, economic crisis that we're all aware of, it's hard to find a growing market, and it is unfortunately a human tragedy that's bringing the growth of this market. But unlike other companies that are facing declining markets, we're looking at an explosive doubling of the size of our market. We've got a bunch of smart people assembled with the proven track records in this area, proven track records in bringing return to investors that are focused on this opportunity. We do not look at anything that is not focused on heart failure, and we want to live up to that tagline that we have, the go-to technology partner for heart failure specialists, and it seems to be a pretty good bet on a bunch of smart people that have done this before, that are focused on a very important, large growing market that is unmet at this time.
There you go, CEO Howard Leonhardt, Bioheart Incorporated. Symbol on that is BHRT, excuse me. And Howard, thanks for coming on RedChip Small Cap TV.
Thanks, Brad.
All right.
This report is not a recommendation or solicitation to purchase or sell any security, nor does it constitute investment advice. Visit RedChip.com for full financial disclosures on RedChip clients.